Hi guys, Mr. Physio here in Australia. Today I'll be talking about the reason why you need to put your legs apart and why it's bad putting your legs together, and show you some exercises to finish with. People tend to put their legs together in everyday life, especially women. Crossing your legs, standing on one leg, putting their weight on one side only. Those habits put a prolonged stretch on gluteus medius, the side hip muscle. Also, if you sleep on your side, your top knee falls into the midline. That will also put a stretch on your gluteus medius again. Overnight, your adductors, the inner thigh muscles, sit in a shortened position, and your gluteus medius are being stretched out and get weak. Then, when you stand or walk, the adductors will pull your whole leg inwards because they're working against each other. So if one side is weak, the other side is actually overpowering, which makes your stance narrow. It gets worse if you have flat feet. Every step you take, your foot arch goes down, and that will make your whole leg rotate inwards more and more, putting stress on the outer side of your hip. So eventually your gluteus medius will become very weak. What happens if you have weak gluteus medius? It does not stabilize your pelvis when you walk, dropping the other side of your pelvis down. And believe me, that will put a lot of stress on your hip, knee, and even low back. When you sit down, you need to have an arch in your low back. But look at me, when I bring my knees together, the arch goes back, which is flattened. And then when I bring my legs apart, the arch goes back to normal. So if you sit with your knees together, you're more likely to slump down as you don't have any arch in your lumbar spine. And that posture is real bad for your disc. So what's the do's or don'ts? Do not stand on one leg. Sit with your knees at least a hip width apart. That simple things can prevent a lot of issues around your hips. Males normally sit like that, but too much is not good, you know that. An absolute no-no is this, crossing your legs. That habit will gradually affect your hips badly. So I will show you a doctor massage first with a foam roller. Lie on your tummy with the foam roller under your thigh and move side to side for 2 minutes. After that, you need to do some gluteus medius exercises. So tight muscle needs to be loosened up and weak muscle has to be strengthened. Of course, there's more than that, so please subscribe my channel to see more contents. Start in a side lying position. From that position, bring your top knee backwards with toes up towards you. So toes pulled up towards you. And think like you're lifting your heel towards the ceiling. Almost 45 degrees to the side, like backwards. Then you will start to feel your side hip muscle working. Also important is your core. Suck your tummy in whole time when you do this exercise. So you can start with 2 sets of 10 and gradually increase to 3 sets of 20 each side, at least 4 times a week. But it's up to you. You have to pace yourself, okay? But try not to roll your upper body backwards. So you shouldn't lean backwards when you do this exercise. Also, be careful not to lift your leg forward ahead of your body. If you bring your leg forward, you will use different muscles. That's why you shouldn't actually lift your leg forward, alright? One tip is to do this exercise with upper body and heel against the wall. So basically slightly push your heel into the wall and lift your leg up and down. And the same exercise can be done in standing. Same thing, suck your belly towards your spine and bring your leg backwards, like 45-degree backwards, and pull your toes up towards you, with your toes also pointing a little bit out to the side as well. You can go as much as you can, but stop when you feel your hip muscle working. So that's enough. Then hold 3 seconds and bring it back slowly. Also try not to lean forward. Stand nice and tall. And you can do it against the wall too, pushing your heel into the wall and slide it up and down. Last tip for sleeping position. Put a high pillow between your legs. I'm using a foam roller just to show you, but you can use a pillow. In this way, you can have your top knee in line with your pelvis, so it doesn't put any stretch on the side hip muscle. Please leave a comment if you have any questions. Thank you for watching.